Hi girls. Okay, somebody asked me to give a little bit of information on how I do lip fillers. Again, lip fillers can be done any way, in any form, and it depends on your injector. So there's not a right or wrong way to do this. I'm just going to pull out this fake skin that I use on grad school just because I don't want to do my lips just yet. I think that they look okay and I don't want to overdo them. I am actually using an insulin, which I always use insulin to inject, and I kind of bend the needle just a little bit for a better angle. So let's do a little example on how to correctly insert the needle. So you don't want to do it too shallow like this. So if you can see the color of the needle over the skin on your patient's lips, that is not the right way and it's too shallow and it'll bubble. You want to go a little bit deeper, but enough that you can actually see the shape of the needle. So not the color, but yes, the shape. So that is actually the right way to insert. So go ahead and just start delivering the filler, and then just as you take the needle out, that's where you inject for a line. Here are my lips, and I'm telling you, if you judge my lips, you are getting canceled. So don't judge. I am not an artist at all. So this is how I personally inject my filler, depending on obviously on what the patient wants and needs, but usually this is how I do it. Never go outside the line of the lip because then it'll migrate. So you want to draw back to make sure that you are not hitting an artery or a vein or cause vascular occlusion. And then as you go back, you inject the filler. And then I'm going to show you here usually my trackings and how I do my lips. So this would be upside down, so up from the top of the lip to the bottom, and then sideways. I would go sideways just like I'm drawing right here. And the same thing with the bottom lip. I would just go from the bottom up and then from the sides. I do not add a lot on the sides just because I feel like it can make you look like a duck.